because you were in the ER, right, for many years at Cedars-Sinai, and you said I said, what's this ozone thing? I mean, why do you like it so much? And I'm paraphrasing slightly, but you said because you've never seen anything get people better like this.
Yeah, I've never seen a medicinal treatment, and this is not medicinal, but I've never even seen a medicinal treatment work this fast. So the beauty with ozone is
cancer. You have people that have had stage 4 cancer.
Yeah.
That give this credit for helping them reverse it.
My most famous case that I personally have had, and I'm in a chat group with doctors who are doing ozone all around the world. I mean, you have to realize ozone is not something new. Okay. Ozone's been around for over 100 years. We used to use ozone before penicillin was discovered. And it was the only way that was used to treat bacterial infections. So if you got sick in 1900 and you got in the hospital with pneumonia, you would have gotten ozone.
Why did they stop it?
They didn't have any antibiotics. Well, antibiotics got discovered, and everybody said, gee, you know, we could take a pill. Why do with ozone treatment? And it fell out of favor. It just wasn't considered stylish. It wasn't considered modern. But in a few countries, Russia, Austria, Germany, they never gave it up. And they've always done it. And now what we're seeing, you may have heard about superbugs, where these bacteria are getting resistant to every antibiotic, but nothing is resistant to ozone. So ozone kills bugs, kills germs, kills viruses, kills bacteria, and kills cancer cells, and simultaneously upregulates your immune system. So you have like a double whammy effect.
So autoimmune diseases, things like that.
Autoimmune diseases respond to this very, very well. Inflammatory conditions in general. I mean, one of the things that I experienced personally is I came in, I was coming down with a virus or a flu. And I came in, I asked my nurse to start an IV on me, give me a treatment. And then she left because she had other things she had to do. So I had to run the machine myself. And at the end of my treatment, I had to reach up here and turn this valve off. I had been suffering from biceps tendonitis from lifting weights. I had really sore shoulder for 6 weeks. Couldn't get rid of it. I reach up here to turn the valve off, and the pain's gone. While I'm sitting on the bed, the pain disappeared and never came back. That's how anti-inflammatory is. So when you talk about things happening fast, it's incredible. I treat people with shingles. Have you ever had shingles?
No, I've known people with shingles.
It's nasty. It's nasty. It's a herpes.
And it shortens the time of it.
1 day.
Is that right?
1 day I knock out shingles.
It seems like that they would have a press conference about this.
Well, shingles breaks out.
Shingles is big business for the drug companies.
Drug companies don't like this stuff. They don't like this stuff because it makes them look bad, and it can replace a lot of medication. You know, when you get a shingles outbreak, you're going to go to the doctor. He's going to give you prednisone, which is an anti-inflammatory, which suppresses your immune system, and he's going to give you something like Zovirax, an antivirus medication, and it's not going to get rid of the shingles. It's going to slow down the course of the shingles, but you're going to get a rash, a nasty rash. It breaks out. It often follows the ribs and things like this, and it lasts for weeks, and then after the rash is gone, a lot of people get what's called post-herpetic neuralgia, which is terrible pain, just because the nerve
you've seen people
was damaged.
But you've seen people you've given ozone to.
So I have this lady. This lady came in. I do a lot of hormone work, as you know. This woman comes in, and we're sitting and we're talking about her hormones. And then she says to me, "Oh, Dr. Liebowitz, by the way, I have a rash. Could you take a look at it for me?" And I take a look at her chest over here, and I could tell immediately she's breaking out with shingles. She didn't know what it was, but I caught it early, and I said to her, "You know, you're lucky. Come on in here. Let me give you an ozone treatment." I give her an ozone treatment. I call her back the next day. Gone. Gone in 1 day. This is normally a condition that could last 6, 8 weeks. Gone in 1 day. So I have always been amazed by this. My most famous case that I was going to tell you about is the woman with cancer. She's probably 52 or 53 years old. She went to the doctor. She wasn't feeling well. She's in menopause. She was never on hormones. They diagnosed her with metastatic stage 4, which is the worst type, metastatic breast cancer. Is in the ribs, is in the pelvis, is in her liver. The doctor was going to offer her chemo. He said to her, maybe you'll live another 2 or 3 months.
Wow.
But, you know, the chance of the chemo working is probably less than 10%. Her daughter was in the pharmaceutical business, and she decided she didn't want to go the pharmaceutical route. So she researched, found me, brought her in here, and we started giving her ozone. I was giving her 4 bottles, just 4 bottles, because it gets more expensive the more bottles we have to do. So she was doing 4 bottles, but twice a week, very, very religiously. She went back to the oncologist at 16 weeks. It was like a month after the doctor thought she wasn't going to live. And they repeated her PET scan, which is a head-to-toe body scan to see if there's any cancer cells anyplace. And the radiologist calls the doctor and he goes, "You sent me the wrong patient," because he put up her first scan, which showed the cancer, and he put up the follow-up scan after she had 16 weeks of ozone, and he thought it was a different patient because there was no cancer on the follow-up scan.
That is interesting.
And that's amazing. I mean, I didn't
That is
expect that.
amazing.
I didn't expect that. I actually could never have said that that was going to
Now,
happen.
in your chats with ozone people across the country, right? Are you hearing similar stories like
Yeah,
this?
I hear stories like this. I mean, I'm in a group of doctors literally all over the world. There's doctors I communicate in Spain, doctors in Cuba, Austria, Germany.
It can't hurt to do it in combination with their therapy, with
No.
their chemo or whatever.
No.
See,
And it does work. It does work
I've
well.
been interviewing medical doctors for the last 18 years, and one of the things they tell me off camera is that when you get cancer, I mean, you're thinking about saying goodbye to your relatives, you're distraught, and you feel like that, and everybody's coming around giving you advice, but you also, they have told me that you feel like that if you don't do this treatment, you're going to die, you're dead. So it's tough to, there's only a small percentage, maybe the Whole Foods crowd, and even those people that would look for these so-called alternative therapies.
I agree. But, you know,
So it's just getting the word out.
when you're giving a choice,